Thyroid problems can cause chronic and debilitating health issues. And if you're somebody that is really suffering with your health, I'm guessing you've probably considered maybe it's a thyroid problem. And the truth is, it absolutely could be. But the other thing that we need to consider is, where do these thyroid problems come from in the first place? And how come so many people have thyroid issues in the United States? There was a recent report showed 20 million people, or 12% of our population, has a thyroid problem. And many people have thyroid issues, but they don't know about it. Well, the fact is, most of the time, if not all of the time, thyroid issues develop because of some bigger, more significant underlying cause. And the truth is, we really need to be able to find out what that underlying cause is. And then, is there a way to manage and deal with and improve, get that underlying cause under control? Some of the underlying causes of thyroid issues can be things like nutritional deficiencies, specifically iodine, vitamin A, zinc, selenium. Those things all relate to how the thyroid functions, and magnesium is another big one. And so that's something that we would like to investigate. Autoimmune issues. The Journal of Endocrinology said that 90% of people that have low thyroid was actually related to a condition called Hashimoto's. If you're not familiar with that, that's a thyroid autoimmune condition where the body's immune system is actually attacking the thyroid and affecting how it functions. We also see toxicity issues are significant. Heavy metal toxicity issues, even primarily. There's another report that talked about using artificial sweeteners would actually create thyroid issues or affect how the thyroid works. And the truth is, most of these things have an effect on our liver, on our gut, on our kidneys, on inflammation in the system. And because of that, the thyroid is then affected. We also discuss with patients and test for things like leaky gut, the inability to digest proteins properly. That's definitely a part of the problem. Even stress and pain can relate to why someone's thyroid may not be functioning right, because of how that affects the pituitary, which is stimulatory for the thyroid. So the truth is, a lot of people may be taking thyroid medication. Maybe they were even to talk to their doctor about it, but they're still suffering. That might be you. And if it is, the truth is, you probably haven't gotten to the underlying, the deeper, more significant health issue that's causing health dysfunction, that's causing the thyroid problem. And guys, we want you to know the truth is, it's in the testing. How do we know what the underlying cause is? We've got to test for it. And we've got to test completely. Some of the standardized testing that's done for thyroid issues or people that have thyroid symptoms, it's just not enough. It's not enough to really understand where the cause, where the deep root cause is actually to be found. So we have a lecture coming up. We really would like to see you there. We're going to go through in detail what these underlying causes can be, and then also how we find them. And it's in the testing. All of the answers can be found in the testing, but the testing has to be detailed and it has to be complete. So I'm hoping that we will see you there and you'll get answers to your questions.